Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 22nd, 2025. This video is in a Lancet article released yesterday online on October 21st, 2025, open access, titled The Effects of Antidepressants on Cardiometabolic and Other Physiological Parameters, a systematic review and a network meta-analysis. Antidepressants are widely prescribed, but their cardiometabolic and physiological side effects are poorly quantified across drug classes. To evaluate and compare the effects of 46 antidepressants on 30 physiological parameters, including blood pressure, glucose, liver enzymes, and heart rate, 105,435 patients across 94 randomized controlled trials with durations greater than 3 weeks comprised the study cohort. Population demographics, mixed age and gender cohorts with diagnosis of major depressive disorder or dysthymia. Statistics Bayesian network meta-analysis, surface under the cumulative ranking, SUCRA, and mean differences were used for ranking. What did they find? Key results: Agomelatine reduced weight significantly, mean difference less 2.44 kilos, while maproteline increased it, mean difference 1.82 kilos. Nortriptyline increased heart rate by about 13.8 beats per minute. Glucose, duloxetine increased glucose levels, mean difference plus 0.52 millimoles per liter. Lipid effects: paroxetine, duloxetine, desvenlafaxine, and venlafaxine significantly increased total blood cholesterol. Limitations: incomplete reporting across studies, higher risk of bias in some trials, and shorter durations limit long-term generalizability. Key takeaways: antidepressant-induced physiological effects vary widely. Selection should consider these side effects in shared decision-making. Clinical pearls: agomelatine may be preferred in patients at risk for weight gain or metabolic syndrome. Nortriptyline has significant cardiovascular effects and may not be suitable for those with baseline tachycardia. No association was found between antidepressant efficacy and physiological side effects, supporting individualized choice. Liver enzyme elevations with duloxetine and others were statistically but not clinically significant. Electrolytes are largely unaffected, contrary to historical concerns around hyponatremia. I found this interesting because way back in 1993, I had reported a case report along with Dr. Ken McCarty in the British Journal of Clinical Practice titled Syndrome of Inappropriate Antidiuretic Hormone Secretion Due to Fluvoxamine Therapy. This was way back while I was working in Aberdeen, Scotland. Eponyms and historical notes. Beer's criteria. Tricyclic antidepressants like nortriptyline are flagged as potentially inappropriate for older adults. The monoamine hypothesis, historical framework for antidepressant action now broadened by systems biology insights. Bayesian network meta-analysis, advanced statistical technique allowing indirect comparisons across multiple interventions. SUCRA, or surface under cumulative ranking curve, is a tool used to rank antidepressants for each physiological parameter. The STAR-D trial, a landmark study that shaped discussion around antidepressant sequencing and tolerability. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.